Egbert Sondorp co-authored an article on promoting health equity in fragile states, published in a special issue on conflict, violence and health in social science and medicine. Egbert, what are the determinants of health in fragile states?
In fragile states, as in most other states, health is influenced by a huge range of factors. In particular, in fragile states, what we see is a deterioration of the environment, which causes an increase of several diseases. But also a number of other things are very important in this area. For instance, the economic downturn, increased poverty in the country, reduced availability of health services or less quality of the health services, and of course the conflict itself, if it's a conflict-ridden area. And often, because those conflicts last so long, there's a collapse of all kinds of institutions which do have an impact on the health of the people.
What kind of health policy framework is needed then in conflict-affected states?
Well, obviously you can't sort these kind of things out only by looking at the health sector. A number of other issues have to be addressed, other sectors have to play their role. Of course, bringing back security is enormously important. But there are other elements why those states are fragile, so there needs to be a political settlement. People talk about that there's more need for state building, but how to do that. But within that overall framework, I think there is an element of trying to work on health, and then we would use a health systems approach.
And so, what do we understand by health systems approach to promote good health?
In most of the fragile states, it's difficult to look things at from a more central level because of there's weakness in the government, weakness of governance, and so this often leads to a number of projects rather than more programmatic approaches. Leads to a very verticalized approach, just dealing with certain diseases. And if we think about a more broader health systems approach, we try to address more of the different elements of a health system.
Great. So what is, to finish, what is really important about the issue of health equity in conflict areas?
Well, I can kind of see three different things. One positive one is that often in post-conflict areas there is an opportunity to address inequities and health inequities by having a proper new health policy. You see that happen quite often in a number of countries. Another element, I think we should not forget that there is an enormous inequity between countries. Fragile states are the countries which have people with the most poverty, but in particular also in particularly bad health. A third one is a bit of an increased threat, I think. There seem to be more and more health funding is driven by security or other political concerns rather than health equity as such. And this may lead to targeting or withholding health funds to certain areas between countries or sometimes in country.